Good morning and welcome to the Spirit of the Heart Leaders Forum for Orange County, being hosted by the Association of Black Cardiologists and Edwards Life Sciences, along with our partners and sponsors. My name is Dr. Jacqueline Ubani. I'm a cardiologist and electrophysiologist practicing here in Orange County. As a longtime practicing cardiologist, I've witnessed firsthand the devastating impact of cardiovascular disease on our community. And I say it's devastating because it is very preventable. Studies show that you can decrease your risk from cardiovascular disease by up to 80% just by implementing some simple lifestyle changes. And now that we have this pandemic going on, the COVID pandemic, which we've been fighting now for the past almost 2 years, we again continue to see high rates of deaths in our communities. So the purpose of this community forum is not only to bring awareness to the fact that heart disease remains the number one killer of people in the United States, with the highest death rate seen in the African American communities. We also want to educate about COVID and the importance of getting vaccinated. And so I therefore thank all of you for attending this forum this morning. I also would like to send a special thank you to our forum planning team, the volunteers, and our sponsors. Of course, programs like this will never be successful without the help of all of our partners. And before we begin this program, I'd like to introduce Dr. Paul Underwood. He is a past president of the Association of Black Inc. and the co-chair of community programs. Committees of the ABC. He will be providing an overview of the Association of Black Cardiologists and the Spirit of the Heart program. And without further ado, I welcome Dr. Underwood.
Thank you, Dr. Rabani, and certainly hello, Orange County. I'm Dr. Paul Underwood. I'm an interventional cardiologist and co-chair of the Association of Black Cardiologists Community Programs Committee. It is with heartfelt pleasure that I welcome you to our third annual Orange County Spirit of the Heart event. This Community Leaders Forum has been designed to advance education and promote collaboration as we look toward getting out of this coronavirus pandemic. As Black cardiologists, the pandemic has really made us all aware of the devastating effect that heart disease has had on our community. This has been painfully seen in COVID-related mortality rates, as well as a rise in mortality and hospitalizations from cardiovascular diseases such as heart attacks, heart failure, and stroke. Our goal is to help Orange County come out of this pandemic stronger so we can continue to eliminate the health disparities experienced by our communities. For those of you who don't know the ABC, we were founded in 1974, and our members consist of cardiologists, health practitioners, and community health members. You don't have to be Black to be a member, and you don't have to be a cardiologist to be a member either. And so we certainly welcome you to put your information in the chat box so that we can follow up with you if you're interested in becoming more involved in the future. We are interested in advocating for all people who encounter barriers to achieving optimal health. The ABC executes its mission through professional and community education, research, and advocacy. We are strong proponents of building a strong cardiology workforce and enhancing the pipeline of African Americans entering the medical careers. For the past 20 years, the Spirit of the Heart has been our signature community education platform, which is now morphed into this type of Community Leaders Forum virtual format due to COVID. We hope you learn from this event and engage with our panelists from Orange County around what we can do to protect the hearts of our people. At the Association of Black Cardiologists, we believe children should know their grandparents and become great grandparents themselves. We would like to certainly thank you, as well as thanking our sponsors, and welcome you to this event. Please engage with our participants and enjoy. Thank you very much.
Thank you, Dr. Underwood, for your welcome message. It is now my pleasure to introduce our Masters of Ceremony, Shelley H. Anderson.
Good morning, everyone, and welcome to our Spirit of the Heart Community Leaders Forum for Orange County. As you've heard, this is our third year that we've partnered with the Association of Black Cardiologists and Edwards Life Sciences Foundation to bring this important program to Orange County. One of our key objectives is to build sustainable community partnerships with folks just like you. We want to build with the faith community, our nonprofit organizations, industry, and our legislators. This morning, we have 3 exciting panel discussions focusing on health right here in Orange County in the community. Throughout our time today, I invite you to please use the chat function. We want this to be a very engaging program. And so please put your questions, put your comments in the chat function, and we promise that we will get to every question, even if we have to get to it after the program is over. So please engage with one another and with us here on the program. You should be seeing the agenda on your screen now. Over the next 2 hours, we will deal with the topics that are outlined. Again, we have 3 panel discussions. We're going to focus on the clergy and faith community. We're going to talk about COVID-19, vaccinations, and the Omicron. And then we're going to talk about community organizations. And what's really exciting is that some of the folks you see, you're going to know probably most of them. So it'll be nice to hear from our friends and neighbors. But first, it gives me great pleasure to introduce to some and present to others Supervisor Katrina Foley. Katrina Foley is a current Orange County supervisor, and she previously served 3 terms as the mayor of Costa Mesa. She was a Costa Mesa City Council member for 14 years. And in addition to her service as a very popular elected official, she's a successful attorney and businesswoman. So please, let's virtually welcome Supervisor Katrina Foley. Supervisor?
Good morning. Thank you so much for including me here. I feel very honored to be able to serve here and to be able to share some of what we're working on in Orange County with all of you. I'm Katrina Foley. I'm your Orange County supervisor. But before I was your Orange County supervisor and before I was the mayor and all of those other things, I actually was a daughter of a single mom, struggling, a Head Start graduate, someone who was raised going to school on the free school lunch program and enjoyed the benefits of that safety net, somebody who went to UCLA on a Pell Grant and then had the opportunity because I had good teachers who cared about me and knew that I had potential to go to law school on a diversity scholarship. And the rest, as you know, is history. So I spend every day of my life trying to give back to those who all made it possible for me to have the privilege and honor to serve here in Orange County. And I try to lead, not just from my skills as a legal advocate and a public policy advocate, but also from my heart, and to take care of working families and to take care of especially the most vulnerable in our community. I ran for county supervisor because of health equity and my concern about COVID and how we were not taking care of our communities of color, of our essential workers who predominantly are communities of color. And I wanted to change that. So I'm really proud of the work we've done. And I want to share a little bit of it with you. Today, who's helping me is our team member, Michael Moss. You can't see him, but he's behind the scenes and he's responsible for helping me get prepared today. So thank you, Michael. Here's our team. We have a great team, a very diverse team, and we are here to serve. Please do reach out to us at any time. Right now, we're in the middle of our coat drive. That's Michael over there on the right. And we are really collecting coats for kids. It's my 13th annual event to collect coats for kids throughout Orange County to make sure that kids have a warm jacket to wear to play or to go to school. Next slide, please. I'll give you just a quick update on redistricting and how it impacts communities of color. We, for the first time in the history of Orange County, have a Latino district right there in the center. Currently, my district is District 2. It's on the left. You can see the cities there. The new District 2 is our Latino centered district. It will include the cities of Santa Ana, Orange, North Tustin, Garden Grove, Anaheim, and a little piece of Tustin. I actually live in District 5, although I'll be the caretaker of District 2 for the next year. So I'll be doing a lot of work with all of you, I'm sure. But I live in District 5. The new District 5, which I'll be running for re-election in, is these cities here. It's the coastal city, that purple area. So we have a lot of great work that we can do over the next year in District 2, and I'm looking forward to the challenge. Next slide. So let's talk about health disparities. And what I think we all know is that the pandemic really highlighted the health disparities within our communities of color, especially within our Black community. And really, we now know, I know all of you cardiologists have known this for years, some of the health risks, but we now know some of these health risks that contribute to COVID and the higher risk for COVID. Some of those health risks include things like diabetes, high blood pressure, prostate cancer, asthma, obesity, preterm birth, HIV, if you are an essential worker, if you are in a low-income community and have no access to quality healthcare or even insurance. Those are some of the major contributing factors to a higher risk for COVID. And what can we do as a county to address some of these things? Of course, healthcare and health insurance is more of a state issue, but we can provide greater access to clinics, more clinics through our Orange County healthcare system. We can work on providing greater access to parks and to open space and making sure that we have parks throughout all of our neighborhoods, even our socioeconomically disadvantaged neighborhoods. We can make sure that we invest in active transportation and multi-purpose trail systems so people can move their bodies, get their heart rates up, start walking and biking on short trips instead of using their cars or sitting around. We can invest in after-school programs that focus on not just sports, but dance and other activities that help young people learn patterns to just keep moving every single day. I danced my whole life until college, and my mom cleaned the bathrooms at the dance studio so that I could dance. Dancing is actually very helpful to keeping your health up. We can also, most importantly, work on creating non-toxic living wage jobs so that people can live their lives without having to put their health at risk when they go to work, so that people don't have the stress of not making enough money to pay the rent. All of these are the contributors of health risks, and these are the things that I can do and we can do as a county to help with us improving and reducing the health disparities. So that's what we're working on. We now at the county have an office of health equity and population and equity, and we are going to be looking at the social indicators and indexes that will help us to really target our services and better understand how to help individuals to reduce their risk in terms of just overall health, but also as it relates to COVID specifically, because as Dr. Chencio Kwong, who is our deputy health officer, often says, COVID is with us to stay. It's not going away. We need to learn how to adjust. We need to start eating healthier, having community gardens, making sure that we're teaching kids how to live healthier lives so that as we adjust to having COVID in our lives, fewer people are at risk. So let's talk about what are we doing right now with testing. Next slide. And with vaccines. So as you can see, and it's kind of hard to read, but this is a chart, and you can see this on the county website, OC Health. The great website to go to is ochhealthfacts.com. But here is some data as to how we're doing in Orange County. We are really one of the most vaccinated in the state, and we also have the lowest population of COVID incidents right now happening out of all of our Southern California counties. So we're really proud of this work. We have 71% of Orange County residents have at least one dose, 64% fully vaccinated, and 16% of kids 5 to 11 are vaccinated. In the last couple of days, we've had more than 20,000 people show up to get vaccinated. So people are getting out there, they're getting their booster and they're getting vaccinated. And that is our top priority, is to get individuals vaccinated. As you can see, I've highlighted some of the areas where we have communities of color and where we are trying to vaccinate. And you can see we're doing a good job. We could do better, certainly, but we're doing a good job. Seal Beach, 84%. Cypress, 80%, at least one dose. La Palma, 82%. Tustin in the 70s. Anaheim in the 70s. So this is very good for our Black community. Next slide, please. So they asked me to talk about how does our Black community compare to the overall community and other ethnic groups in Orange County. And I worked with our health office and they provided this data for me. And in Orange County, our Black community represents about 1.6% of our resident population of 3.3 million. And the number of COVID cases is approximately 1.4%. Number of COVID deaths, approximately 1.2% of that 1.6%. The great news, I think, is that 89% of our Black residents over 65 have at least one dose. That is fantastic news because that's the best way for us to prevent COVID from spreading. And then 56% of our Black residents under 65 have at least one dose. Now, that number is consistent with what's happening with our middle-aged families across Orange County. And we've got to do more to really help our middle-aged families across Orange County to get vaccinated. There's something about ages 25 to 50 where they're not getting vaccinated as quickly as others. But overall, our Black community has been impacted by COVID, but according to the county health office, it's not as disproportionately impacted compared to other groups. And that's something that's good. We want to highlight that, but we want to still get into those neighborhoods and those communities where we still have work to do. Next slide. Now, we've been doing COVID relief press briefings. We just did one yesterday. You can watch it on our Facebook at Supervisor Foley. And then you can see every time we have a COVID briefing, we put it on our website. Dr. Chencio Kwong usually gives a COVID update. Anytime any of you would like to come on, we'd love to have you to talk about issues in the community and how we can help and to educate the community. We're also doing COVID clinics and we're passing out test kits now. As we start to learn about the Omicron virus, we are really worried that people are going to think that they just have a cold or the flu and they're not going to get tested. So we're passing out free test kits and we'd love to get those out to any of you. If you're interested in getting a test kit or many delivered to your church or your business, please just put your name and email in the chat or private message Michael Moss, and we will get those delivered to you because we want to make sure that everyone is getting tested. These are free test kits. They can be delivered to you either at your place of worship, business, or school, or you can go online and at ocvaccinefacts.com and you can have it delivered right to your home. Next slide. Other COVID relief efforts, COVID hit our small business communities hard, hit our musicians and our artists hard. And so our board voted to give funding for grants to support our local businesses, our music and arts organizations and businesses. And then we also are working on a meal gap program because food insecurity has been just incredible. We've really shown that there's so many more families in Orange County that are in need of food, basic nutrition more than we ever knew. And so we've been giving out grants. We've given out about $1 million in grants. And I, as a former dancer, have tried to focus on cultural dance groups and organizations in our district, and really focusing on trying to support those groups, as well as I supported our city's concerts in the parks. Here's Michael giving our certificate and our check to Mayor of Fountain Valley, which is in our district. We also have meal programs. We're supporting meal delivery. We're supporting individuals living in affordable housing. We're putting together meal grocery cards for them. We have Save Our Youth that we're giving grocery cards to. Share Ourselves. Many of our homeless advocates are helping us to get out grocery store gift cards. We did a survey, and the survey from all the different nonprofits and individuals determined that, yes, the meal boxes are fantastic, but maybe they're not culturally sensitive to the kind of food that a particular group is really used to eating. And one, and two, they don't take care of other necessities like laundry soap, dish soap, toothpaste, toothbrushes, that kind of thing. Toilet paper. So we are really working on trying to get those funds out. Next slide. And then what do we expect as we move forward? And how can we continue to protect ourselves? Just use common sense. Do the same thing we've been doing all along. Wash your hands, which is so shocking that we have to keep saying that. Wear your mask if you're indoors around people that you don't know are vaccinated, or if you're going to be indoors for a lengthy period of time around people. Get tested. You can get tested for free. There's testing starting at the airport, at John Wayne Airport. As every passenger gets off the airplane, we're going to hand them a test kit. We also have a Hogue Wellness Center there, where if you have insurance, you can get tested for free and get a rapid test. And then most importantly, stay home if you're sick. And if your employer is trying to make you come to work when you are sick, then you should contact someone to get assistance, because you should not have to go to work if you're sick. And it's not good for the other workers if you're sick to go to work. Next slide. All right. Well, that's our presentation, and we are really here to serve. You can contact our offices. You can follow me on Supervisor Foley on all medians, and we really just want to be a resource for your organizations and for you as individuals and residents. So thank you for including us in this program. And I see in the chat, there's a lot of people requesting test kits. Yes, we'll get those out to you. Michael will collect all of these, and we will get those out to you next week. So please do use this resource, because we're here to serve. Thank you.
Thank you, Supervisor Foley. Thank you so much for everything that you're doing in the community. And I just want to reiterate, absolutely, those of you who are requesting kits and other resources, we will be certain. We have folks monitoring the chat to make sure that we get those resources to you. So keep the comments coming and keep the requests coming. Also, Supervisor Foley highlighted a little bit about our first panel, which is going to be on COVID. But before we have our first panel, I want to introduce to you Mr. He Nguyen, and he is the Director of Health and Equity at the Orange County Health Agency Office of Population and Health Equity. He's going to give us a few comments. And right after he does, Miss Katie Calvoda will come on with a wonderful presentation where she's going to show us, broken down by zip code, the disparities right here in Orange County. Katie is the president of Advance OC, an organization that uses innovation and strategic philanthropy to address inequities in Orange County communities. But first, Mr. He Nguyen.
Thank you, Shelley. And my name is He Nguyen. And first, I'd like to thank Orange County Board of Supervisor Katrina Foley for an extensive overview of Orange County health, including COVID-19. Again, I am from the Health Agency Office of Population Health and Equity, which is the new office that was created and established in December 2020, right before Supervisor Foley took office. And so we really want to thank the Board of Supervisor, including Chairman Doe and Vice Chairman Chafee, for their support in creating the office, and their continued support in ensuring that communities of color are not left behind. So the goals of Orange County Health Agency Office of Population Health really focuses on two goals. One is to ensure that we have equitable policies and practices when it comes to health, especially ensuring the health of communities of color. And then two is partner with cross-sector stakeholders, including non-traditional providers like the churches that you will be hearing from today, to be responsive and be equitable in our service delivery, including COVID-19 responses. The first big initiative, as Supervisor Foley have mentioned, is our Equity in OC initiative that will be launching in the new year. This is a CDC-funded grant where Orange County will be focusing on four main principles to ensure equity in OC. The first principle is building collective capacity, one for HCA, other system, as well as the community to address and take actions around health equity, and for sustained community partnership, as Shelley has mentioned just now. The second focus for the Equity in OC initiative is really addressing social determinants of health. Supervisor Foley gave us a taste of what kind of conditions are impacting the health of our communities. And so we will be addressing social determinants of health through action and learning communities that will be created throughout Orange County. And the third focus for the Equity in OC will be ensuring equitable participation. So how do we make sure that cross-sector, inclusive of traditional and non-traditional providers like the churches, including grassroots organization, so that we don't just expand the table of who's included, but create mechanisms so that organizations that have historically not engaged, or we have not engaged, to be at the table when it comes to health equity. And then the fourth principle, which is around community and data-driven. How do we make sure that Equity in OC as an initiative is community-led, and also have it be led by data, what we see in the data. So today is a great demonstration of what can happen when something is community-led and actions are driven by data. As you'll be hearing from the pastors and reverends of the Black churches that HCA worked with to ensure that the Black communities in Orange County are vaccinated and continue to be vaccinated and stay safe. And then also you'll hear HCA's partnership with Advanced OC to create the first ever OC equity map, looking at the 50 social and environmental indicators of health and well-being to drive our planning and decision-making around the pandemic response and beyond. So without further ado, please welcome Katie Kawoda from Advanced OC as she talks to us about the OC equity map and drilling down on the data at the census tract level. Katie?
Thank you so much. It's my pleasure to be here today, and I'm going to try to keep us on time, so go through these slides relatively quickly. But I do want to extend an invitation to all of you to reach out to us if we can be of service to you, if we can do a presentation to your organizations. We're happy to do that. This is, as Hugh said, a community-led effort, and so we want to have as much participation from the community as possible. This is us. Our website is advancedoc.com, and you can go on it afterwards or reach out to us for further information. So our theory of change is very simple. We ask the question, what would you do if you knew where suffering lives, where poverty persists, and dreams are denied? And oftentimes, anecdotally, as a community resident, we think we know where these pockets of suffering and poverty exist in Orange County, but a lot of times we don't have the data to illuminate those exact populations. And so what we want to do is partner with local elected officials, city managers, nonprofit organizations to be able to identify it with a little bit more resolution. Here's our all volunteer board of directors. We are all members of the Orange County community, longtime volunteers that have been engaged in the community for many years. Our premise is basically Orange County can be a tale of two horizons, right? We have areas in Orange County that have some of the most beautiful landscapes, but we suffer like a lot of different communities across the country with systemic health, housing, education, economic, and opportunity disparities. And how do we feel that we can start closing these gaps? At Advance OC, we believe that the first step is to diagnose our communities, to diagnose our neighborhoods, not just diagnosing patients as we would see them in clinical settings, but also understanding the built environment in which our patients come from. So how we did that was we partnered with an organization called the Social Progress Imperative. They're a global entity that has done the Social Progress Index and computations for the United Nations, for the European Union, even for the state of California. And so we took that methodology and we brought it to Orange County to be able to dissect these neighborhoods with the kind of information that really matters to people. And what does that look like? This is the Social Progress Index that we created for Orange County. And it contains, as Hugh said, over 50 different social and environmental indicators broken out by 3 different dimensions. So we have basic human needs, foundations of well-being, and opportunity. And underneath those layers of data and categories, we have various different indicators that we have computed using something called principal component analysis, where we really dug into the drivers of each of these areas. And we use that to identify areas of low social progress and areas of high social progress. And what you're seeing here is a snapshot or a screenshot of the Orange County Equity Map that is on our website, as well as on equityinoc.com. And as you see here, the base layer that you're seeing is the Social Progress Index scores for all 580 census tracts in Orange County. And when you look at it, the yellow areas that you're seeing are areas that score low on the Social Progress Index, and the purple areas are areas that you see score higher on the Social Progress Index. So you definitely see a bifurcation between North and South County, as well as areas that are highlighted in the center part of Orange County, where our communities of color live. So that's an obvious disparity that we see in Orange County, and we're working with the healthcare agency and other agencies in order to solve that. And so, of course, being able to capture data at the neighborhood level or at the census tract level, we're also able to roll up those scores at the county level, as well as the zip code level and the city levels. And then because we are collecting that data at the census tract level, we are able to identify the top 50 census tracts and then the bottom 50 census tracts in Orange County and everything in between. So we created a lookup feature on our website where anyone in Orange County can type in their address and be able to see a scorecard that looks very similar to this, which has all of the information for the Social Progress Index and the 50 indicators that we track. And so what does that mean for us in real terms, in practical terms? So we partnered with the healthcare agency to really take a look at the pandemic and what was going on during COVID-19. And ultimately, when we talk about social determinants of health, we're talking about a manifestation of differences in life expectancy. So you see here, this is a map of the Orange County equity map for the city of Anaheim. And you see where we called out this, where Disneyland is. And across the street from Disneyland, the neighborhood has a life expectancy of 75 years. And then down the street from Disneyland, we have a life expectancy of 89 years. So the discrepancy between these numbers and between various different neighborhoods in Orange County is really at the heart of our work, what we're trying to address through various different initiatives. So here's the equity map again, as I showed you earlier. And then when we overlaid COVID cases on top of the equity map, what you'll see very clearly is a very high positive correlation between where we saw COVID and incidence of COVID and the underlying, social progress indicators. So we know that has happened with COVID, as with every other chronic conditions, including heart disease, is that the built environment, or what we call social determinants of health, play an outsized role, a determinative role in who gets sick and in our community. So we're proud to say that we partner with the Orange County Healthcare Agency to address these social determinants of health, because we have not been able to do that systematically, in our community. And so one way we did that during the pandemic was to create a custom COVID vulnerability map. And what we did here is we combined underlying health and comorbidity risk factors, such as those that were pointed out by the CDC as having an impact in who gets COVID and who gets really sick from COVID. And that's the people that have diabetes, cancer, obesity, high blood pressure, and other things that you see on the screen, combined with social vulnerabilities. So people who live in isolated communities, people who don't have internet access, those that live in housing burden communities, et cetera. All of those things that we are tracking under the Social Progress Index. When you combine those risk factors, you get a very comprehensive look of who is vulnerable to COVID. And we can do the same for all of the other chronic conditions in Orange County as well, allowing us to have a very targeted and data-informed look at how we cure some of these conditions. And then finally, I just wanted to end with a couple of comments about social determinants of health. When we talk about social determinants of health, we're talking about not the 20% down here by the bottom of the figure. That is the healthcare, access to healthcare, or the quality of care that one would get in a clinical setting. We're talking about everything else, up to 80% of the other elements that come into play. So healthy behaviors, the physical environment, socioeconomic factors. Those are the things that we'd consider to be root causes of some of these long-term trends of chronic conditions. And what we're seeing with COVID is the same thing that we're seeing with other health conditions, including diabetes and cardiovascular disease. And so what we have to ask ourselves in Orange County is this a moment or a movement? So before COVID, we know that the net worth of a typical white family in the US is 10 times greater than that of a Black family. We also know that people of color make up a disproportionate amount of low-wage workers in America, who were, of course, hardest hit by the pandemic. And then women of color in particular accounted for 53% of those workers in the food service industry and healthcare industry as well. So when we're talking about healthcare, we must talk about the things that impact our healthcare, the 80% of the things that impact our healthcare above and beyond the clinical setting and the services that we get in the clinical setting. So I would just point out to a statement by Dr. Martin Luther King Jr. He said, it is cruel jest to say to a bootless man that he ought to lift himself by his own bootstraps. We are responsible collectively as a community to be able to create the circumstances for good health, for equitable health. Everyone deserves a chance to thrive in Orange County, and that is our mission and what we're trying to do with this work. So with that, here's my contact information. I welcome you to reach out to us at any time. We're happy to engage with you in whatever capacity that you'd like, and know that we're here as a community resource for all of you.
Wow. Thank you so much, Katie and Hune. That was a powerful, powerful presentation. We might think certain things, but it is absolutely riveting to actually see the data in front of you, to see the numbers, to hear the presentation. And I want everyone to know that the presentation, Katie's entire presentation, is available on the ABC website. You may also contact us. You could contact me. We'd be happy, or Katie, to get you that presentation. And please, please, I know she offered, but let me just reiterate, if you have a community organization, a church, a fraternity, a sorority, Katie would be very happy, and Hune, to come and give a presentation at your organization. I think this information is riveting and critical, not just for the African American community, but for all of the communities in Orange County. So thank you so much. And I also just want to welcome those of you who might be just joining us. This is the Association of Black Cardiologists and Edwards Life Sciences partnering together for a dialogue. And our topic here is Our Health Matters. Our Health Matters. So thank you, Katie and Hune. Now, we're going to get started with our first panel. And that panel is about COVID-19 and all of the elements surrounding COVID-19, including vaccinations. You've met most of our panelists. You've met Katie and Hune. You've met Supervisor Katrina Foley. But we have two additional individuals who are joining us for this panel. So I'd like to introduce Richard Hurt. Councilman Richard Hurt was elected to the Aliso Viejo City Council in 2020. So welcome, Councilman Hurt. Also, Dr. Tista Ghosh. Dr. Ghosh currently is the Vice President of Employee Health at Edwards Life Sciences, who is our partner today. She is a physician trained in both internal medicine and she is a CDC trained epidemiologist, excuse me. So I'd like to welcome you. Also, you met Dr. Jackie Ubani, who is going to join this panel as well. So welcome to all of you. Thank you for being on our very first panel about COVID-19. And we're going to just dive right in. And what I'll do, I have some questions that I've prepared. Audience, please put your questions in the chat. Let's see if we could get to those. And I'll direct my questions at one of the panel members, but panelists, please feel free to jump in. So my first question is, given heart disease is still the #1 killer for all Americans, how has the pandemic impacted cardiovascular health in communities of color? And I'm going to give that question to Dr. Ubani and Tista Ghosh. Dr. Ghosh, if you'd like to jump in as well.
So hi, good morning again. Good to see all of you. So we know that with the advent of COVID and with the quarantine period that we had in the beginning of this whole pandemic, people were not going to hospitals to address their heart health issues for fear of catching COVID. So during that first few months, actually several months, almost a year, we hardly saw people in the hospitals with heart attacks, chest pains, which was kind of strange. Also, people weren't going to see their doctors, again, because of fear of COVID. And of course, being quarantined at home, nobody was really sticking to a heart-healthy diet. People were eating whatever they wanted. You know, the rates of alcohol consumption was high. So everything that was counterintuitive to a healthy heart was happening during this quarantine. But we tried as an organization, as an association of cardiology, to educate people to go to the hospitals to get healthcare, to get attention for whatever health issues that you're going through, and not to worry so much about COVID, because you're more likely to die from your cardiovascular illness than you are from catching COVID and dying. But things have certainly improved. I think people are more aware of that fact now, but we think we will see the impact of this in the next few months to years. And it won't be pretty.
Thank you.
Yes.
Dr. Ghosh?
Yeah, and I'd love to add to that because absolutely it was a problem initially, but I also think we're going to see long-term problems because the coronavirus actually, we're learning, infects your blood vessels themselves, which blood vessels pretty much go everywhere, including your heart and your brain. And so we are slowly starting to learn that COVID itself is a risk factor for heart attack, for strokes. And there was a study recently with veterans that found that veterans who got COVID, a year later, they were more likely to have heart failure compared to their peers of the same age and similar conditions. So we may see an explosion of heart-related issues added to what all that we already have in communities of color. So it's important to really think about that and proactively message that to our communities of color so that they're aware and know to go to their doctors as soon as they have any symptoms or even before.
Thank you. And thank you and Dr. Ubani for being essential frontline workers out there serving the community. This next question, I'm going to throw this one out to our elected officials. And I'll start with you, Supervisor Foley, and Councilman Hurt, please jump in. In your opinion, what local, state, and national policies exist that act as a barrier to healthcare access and optimal living? Are there any barriers that are national policies or perhaps local policies that you see?
I kind of think of it in the opposite way. What can we do to open up access? I don't know if I could come up with a list of barriers, but barriers might include housing. Housing is a barrier to having a healthy lifestyle. Sometimes people have to live in housing that is infested with mold or is dense housing. Especially what we've learned in COVID is that those communities where people are living densely, small housing with lots of people in it, there's more likelihood of having COVID infection spread amongst the family members and friends. So housing and opening up housing opportunities, maybe that's a barrier where there might be restrictive housing. I guess you could think of it like that. But access to healthcare and having, I think, health insurance. I've long been a huge advocate that we insure everyone and that we provide healthcare for all. And so that's a barrier at the national and the state level. Not enough opportunities for people to have quality healthcare without having to pay an expensive price that cuts into their budget, prevents them from buying food, paying rent, etc. It's all connected.
Yeah, absolutely. Councilman Hurt, did you want to jump in?
Yes, thank you. But yes, I would specifically say, affordable healthcare is definitely a barrier. Access to healthcare is a barrier. Because at least from my perspective, Black people and minorities were not genetically more susceptible to COVID-19. It's what I mean by that, it's not a Black person's disease, right? But when you add in those like the socioeconomic status, less access to healthcare, chronic conditions like heart disease, when you're infected with COVID, the recovery is difficult. So those barriers specifically, affordable healthcare for everyone and just the lack of access, those are huge barriers.
Thank you. Absolutely. And then, Katie, I know you already addressed some of this, but did you have any comments any other comments on this question?
Yeah, I'll just say that we have to take a look at our healthcare delivery system to make sure that it is free of bias and that there is an opportunity for folks to have cultural competent healthcare in Orange County. I know that that's a big concern in various different hospital settings across the county. There are, lots of hospital systems that are making great strides here, where they're having translators and folks that do a lot of outreach into different communities to understand those barriers. So us having to have that conversation with them and understanding that there is a need to overcome these barriers is a high priority.
And Shelley, I think to add to Katie's point, I think when we talk about access, we also have to think about access to what, right? Are we getting the right access? So are we getting access to care and providers that are culturally competent, that really doesn't hold racist, sentiments, et cetera? I do think that in terms of barriers when it comes to policy, we as a healthcare system tend to look as people as parts rather than whole, right? So we treat people's conditions separately. Mental health is treated separately than physical health and whatnot. There are initiatives that are coming down the pipeline that really are trying to address kind of the treating people more holistically rather than silo parts. I do think that in terms of healthcare and policy, we are moving towards the healthcare providers being able to also attend to the social determinants of health, right? What are the conditions that are impacting people's health and health outcome? You saw the slide that Katie pointed out. About 80%, of the biggest predictors of health and well-being is outside of the healthcare setting. Right? What are those conditions that people are facing that they are needing support in that healthcare can be a part of the solution? And so I think those are some of the barriers that we're definitely working as a healthcare system to address. And it's going to take some time for it to work itself out.
That's exactly right. That's exactly right. And this conversation must continue in your homes and in your churches. I want to try to be sensitive to the time, so I will just throw out one final question. What actions can we take? And again, everyone feel free, but perhaps Councilman Hurt and Supervisor Foley, what actions can we take to engage local governments and agencies to be an active partner and a change agent to address cardiovascular health and healthcare disparities? And everyone might have a brief comment on this. But we really do want to, again, build these sustainable partnerships. So how do you suggest, Supervisor, that we engage the government?
That's a really wonderful question. And before I answer it, I want to congratulate Mayor Pro Tem now, Councilmember Hurt, for his new promotion, and looking forward to working with him in that new role. I know he will prioritize these issues. Well, how do we engage? One of the things that I have really been trying to encourage people to do is to get involved in your local government, join a committee, apply to be on a commission, apply for the county to be on. We have, I don't even know, 34 commissions and committees. Apply to participate. There's vacancies all over, whether it's at the city level, at the school district level, special district, county level. And the reason why we need your voice is because those committees, commissions, and boards have been occupied by people that don't reflect the people on this panel for many, many years. And so we need to diversify these boards and commissions. We need to start getting different voices that will help us to understand different parts of our community that have been left out. So that's, I think, one way. The other way, email your elected officials, call your elected officials, let them know what you think. I mean, my door is always open. I may not agree with you all the time, but I want to hear from you. And I want to be able to dialogue and find those places where we can come together and do good work. So please do call, email, and get involved.
Dr. Ghosh, did you want to jump in on this?
Sure. I would just add to that and say a lot of times communities of color stay silent, and we really need to be heard more. And that involves speaking out, whether that's through joining committees or actually showing up to testify at hearings, or just sending an email or a letter to your representatives, because the more we make ourselves heard, the more quickly change will happen.
Absolutely. It really is the squeaky wheel principle. And so I encourage all of us, not just panelists, but certainly all of you in the audience, I encourage you, please get involved, join a commission, send an email, show up at the Board of Supervisors meeting and make a public comment. Get involved. So because you are that important, and because you're important, your voice deserves to be heard. And so this conversation was not long enough, but I want to thank our panelists. Thank you, Dr. Ghosh. Thank you to our Orange County sponsor, Dr. Ubani. Thank you, Mayor Pro Tem Richard Hurt. Thank you, Hee Nguyen from the Office of Population Health and Equity. Thank you, thank you, thank you, Katie, for that powerful presentation and for your comments. And again, reach out if you want the presentation. And as always, thank you so much, Supervisor Foley, for what you're doing. Thank you for being a part of this important conversation. And we wish you all the best moving forward.
Thank you, everyone.
All right.
Thank you.
So, and I hope you are engaging in our discussion and placing your questions. Again, as a reminder, we want to hear from you. And even if we can't get to your questions now, what we pledge is that we will get to every question and get you an answer from the appropriate person. So keep them coming. Our next panel is a very exciting panel as well. So we have the 3 C's today. We had our COVID panel. Now we have our clergy panel. And we have 3 local African American pastors. Many of you know them, but I will introduce them to you briefly. So first we have Pastor Shanetta Goodjoin. Reverend Goodjoin is the pastor of the New Hope Presbyterian Church in Anaheim. Her church offers ongoing blood pressure screenings, CPR training, mammograms, and most recently, they've partnered to even have COVID vaccinations in the church. So welcome, Pastor Goodjoin. Then we have Pastor Ivan Pitts. So many of you know him. He is the pastor of Second Baptist Church, one of our largest churches here in Orange County, a very active church doing great work in the community. And they have a very robust health and wellness ministry at the church. Second Baptist is a church dedicated to serving the people of Orange County and beyond. And so we welcome you, Pastor Ivan Pitts. And last but certainly not least, so excited to introduce Pastor Curry. So many of you know him. He is the pastor of Friendship Baptist Church, one of our largest churches here in Orange County. And I just want to acknowledge Pastor Curry and his wife, Lady Karima, because they have been working with us for months on the planning team for this event, and they're responsible for helping pull this together. So we welcome all of you, Pastor Curry, Pastor Pitts, and Pastor Goodjoin. Thank you all for being here today.
Thank you.
So we know that historically, the Black church is the center of Black life and has been. So historically, if you were a banker, a Black banker, a comedian, a singer, an artist, a painter, the Black church was the center of Black life. And so it's just good to know that you all as African American pastors and just pastors who care for people, who are feeding the sheep in Orange County and beyond, are also conscious about the community and what's happening in the community. So I've got a couple of questions here. Let's jump right in. And I'll start with you, Pastor Curry. Share with us what concerns you're hearing from your congregation about vaccinations. I know, and we heard earlier that we have a pretty high level here in Orange County, but we do know that there is still some vaccination hesitancy. So share with us, what are you hearing from your congregation?
Good morning again. Thank you, Shelley, for that question and for the acknowledgement. We have been excited to work with Spirit of the Heart and with the Association of Black Cardiologists. It's been a joy to kind of see this all come together and for us to arrive here today. When it comes to vaccinations, it is the same thing, and I'm sure my colleagues will say it, is that idea of, I don't know what's in this vaccine. And so that's where we've had to really hone in on education, helping people to understand the development and how it's done. I love working with doctors who enjoy talking about the process by which the vaccines came to be. When that happens, you know, some of us don't like all the jargon and the deep conversation, but I think when we see doctors who are excited about the vaccines, their development, even how fast they were put together, that communicates what I found with my congregation. It communicates this idea of it being safe and being trustworthy. Most people are concerned about that. Of course, there's also that idea of our history, right? Where African Americans were utilized as test subjects without their knowledge and without being fair towards them. And so there's still some of that. There's some angst when it comes to that. But for the most part, we are seeing that our people are desiring to get to vaccinations, provided that they really give us what we say they're going to give us, some freedom. And now, Shelley, our big piece is to get people not only to do the vaccine and get fully vaccinated, but now to move them towards these boosters and to understand why the boosters are important. Because, you know, that brings a whole nother level of questions. Not only, why, and we have to be able to explain it the same way we explain flu shots and other series of vaccinations. But I didn't realize until we got to this COVID vaccination, how many people don't get flu shots. I always practice getting one every year, but there are a lot of people who the angst has not just been about the COVID vaccination. There were people that had angst about even a flu shot and what it does. And so it's education and showing, I think what I found with my congregation, they are really intrigued and appreciative of information that follows. You can't just say get a shot. Show why, show some numbers, show how it helps, how it makes a difference.
Excellent, excellent. How about you, Pastor Pitts?
So I think I echo the words of Pastor Curry. It is a great honor to be here, and thank you all for the time. I think the hesitancy was around the speed of the vaccine. Yeah. How is it that, you know, we don't have a vaccine for H1N1, SARS, so forth and so on, then out of nowhere, boom, get it, you have vaccination and you should get it. And we know that there's some reasons for that, legitimate reasons, right? It's not what it seems. Secondly, many wanted to take the wait and see approach. Let me see how other people, you know, respond, and let me see, you know, if there's going to be side effects. You're like, will I grow a third arm, and you know, and will my ear move to the center of my forehead, and are there microchips in the vaccine that people can now track me? As ridiculous as that may sound, I had highly intelligent people coming to me and say, yo, Pastor, now tell the truth. You know that the government, I'm like, oh my gosh. But that goes to the last piece, and I'll save some for Dr. Goodjoin, is that distrust in one institution leads to distrust in others.
That's
our
right.
Distrust in the judicial system, our distrust in the prison system, our distrust in the educational system, our distrust in the government leads to distrust across the board. And when you have a mindset of distrust where you're always suspicious, you're always looking over your shoulder of what's really going on, it actually creates a mental block of trust. And so we call that trauma. So we live in a world that we can't trust, and we have documented reasons why we can't trust. And then we have this, what we call trauma. And then we don't even talk about fertility issues, right? Will I be able to have a baby? When they told me that was one of the concerns, I got 2 shots because I don't want no more babies. But anyway, that's just me.
All right. No, but what you said is real. And I'll just say that my own son, who's a college educated 26-year-old, told me he was not getting the shot. And of course, as his mom, I was, up in arms. And he said, well, I don't know what's in it. And being his mom, I said, well, you don't know what's in hot dogs, but you eat that. So, but I know that's not a great answer unless you're the mother. Pastor Goodjoin, you want to jump in here? What are you seeing and what are you hearing in your congregation?
Thank you so much. I'm so glad to be here and thankful for Spirit of the Heart, as well as Reverend Curry for all he did to help us rally in. I agree with everything that's been said. I saw that in the beginning there was this pendulum, and no matter how far out it swung, fear was on each end. So the pendulum swung to the left, and it was filled with conspiracy theories, a lack of trust. As you all have already said, I don't know what's in this. I'm not sure why I need to take this. Who is giving us the information, and can we trust that information? And then secondly, I had those in the congregation who immediately isolated, went into their homes, would not come out, not going to let the family and children in because, you might have it and I don't want to get it. I'm vulnerable. Or even getting pockets of information and running with that information without having a full scope of knowledge about what's happening. So I think that the church, as the Black church is the bedrock of justice and equity and equality, is contingent upon us to try to do our best to give the best information, to give people who are scared a sense of assurance from the best cardiologists, the best doctors, reliable sources. Because oftentimes, as my brother said, we've lived a life in which we don't know how to trust. And that's a legitimate concern. Yeah. It's a part of, being disappointed so many times. I mean, I think if you really want to know the truth, I think that racism is a public health issue. Right. That begins to show itself up in all of the information that we receive. We don't know if we can trust it. Yeah. We don't know if it's really for us. We don't know. Are we being test subjects again? I had, like I said, I had that pendulum swinging at New Hope in both directions. Can we really, this was one of the questions, if we sing, could we possibly spread the virus? Do we need to wear masks, even if we're outside? So many questions. And so that's what's been going on. It's gotten better, but there's still pockets of people who don't say anything, but I know they're not vaccinated and they're not going to get vaccinated because they just are waiting to see what happens. And the booster doesn't help that mindset at all.
Right.
It doesn't.
Right.
It really doesn't.
And Shelley, I think that the thing that both Pastor Pitts and Pastor Goodjoin bring to bear for us that we have to understand is that this idea of trust is muddled and made worse when there are different opinions. When you've got one thing on CNN, another on Fox News, and more of us watch Fox News than we actually will admit to it. I mean, you've got a lot of different opinions out there, and then all of these opinions start to muddle it. There's no good, clear message that comes to us, and then we in our churches are debating it. And I love what Pastor Pitt said, that we have distrust in a variety of areas, not just health system, but the judicial system in these other areas. And that starts to impact how we view what we do next, and if we do next, and when we do next.
Yeah. May I, you may have another question.
Please.
But here's what I want to say. You have a right to question. You have a right not to get the vaccine. You don't have a right to be ignorant about the reality of the situation.
That's very true.
That's what I challenge young folks. And then I also challenge where you get your information from.
That's right.
Right. And so I think that
trusted sources.
Yes, trusted sources. TikTok is not a trusted source.
Nor is Instagram.
Right.
And I would like to say this. I think that the church has to define its voice in being the place where trust exists.
Amen.
And so when we did this vaccination clinic, I saw more people come out and begin to trust because they saw a collective voice from the pastors.
That's right.
Saying, this is what we need to do. Yeah. You can trust us. We're in relationship with one another and we got your back.
Yeah.
So I think that we have to continue that kind of collaboration and those partnerships that foster a sense of assurance that we're not going to try to take you into a place of greater despair.
Yeah. And Shelley, we're sorry, we're pastors. We take over the panel discussion and we love each other. So we work together. But I love what Pastor Goodjoin said. It was not, when we came together to do the vaccination clinic, it was not about which church, who's going to get the glory for it. We chose Second Baptist. It was the easiest access. It was the best place. And my heart and Pastor Goodjoin's was, if that's the best place, let's go there.
Let's do it.
And then we had a collective statement, not just from Second Baptist, not just from New Hope, not just from Friendship, but also from CORE, which covers that whole South County, and then from Johnson Chapel, which is a historic church in Orange County. That was very important to us, that there was a collective voice, that we all came together and said vaccines were important. Not only did we support clinics, but we got shots in our arms as well. Yes. We stood there with our congregations as they stood in line to get their shots, sat with them as they waited their 15 minutes to make sure nothing happened. And so that's a collective piece. I know people in Chanetta's church. I know people in Ivan's church. They know people in our church. We're not outlaws. We are friends, and we come together. Absolutely. And that's what gives us weight in our voice about vaccinations. And I'll even take it a step further. That's what will give us a weight in our voice when it comes to the message from the pulpit, when it comes to our heart health. It will help us in that regard. And that's what I think is important for us as a church. We have different denominations. We have different geographic portions of our ministry, but ultimately we're coming together because we want our people healthy and whole.
Sure.
We want them to be able to survive and get through this, and not just survive, thrive. We should be able to thrive in the middle of a global pandemic, especially if our churches are honest with us and speak truth to power and truth to the pandemic. I know we say truth to power, but let's speak truth to the pandemic. What are the things we need to do to make effective change?
I found it very, very inspiring to see the line of people at Second Baptist. And there were people from CORE, from Friendship, from Johnson Chapel, from New Hope, who were in line relating to one another, collective in a voice of, and I'm thankful for the Orange County Health Agency who called us all together to do this, because it becomes a model for what we need to keep on doing.
Yes.
To not only fight, to fight the fear, but to empower the people to trust that we are trying to bring the best knowledge that we can to community.
And I think it's noteworthy to understand that it's not just our church members.
Yeah.
It is not just people who are Christian or Black Christians. The Black church has become a place of trust for the grassroots of our communities, right?
That's right.
There are people who don't believe in our God, don't believe in our practice, but they trust our voice.
Yeah.
Yes.
And I think that is important, that, sometimes people don't want to partner with the churches because they think that we have this kind of binary view, either in or out. We've never had that view, in or out. If you're in our community and you want information, we will serve.
Yes.
So I think that's important. And last thing, I think that what you're hearing from us today, you'll hear from Curry in the pulpit. You'll hear from Goodjoin in the pulpit. You'll hear from Ralph Williamson in the pulpit. We're not duplicitous. We're not saying one thing in this forum. We're not saying it in the pulpit and in our offices and so forth and so on.
Yes.
That is awesome. I know Pastor Curry at Friendship, you all have a food bank and folks from all over the community, Christian, non-Christian, Muslim, come because you are a resource. And I know all of you are doing various things, but a resource for the community. And we sure appreciate that. And we're going to be doing a special presentation for the three of you and a couple other pastors coming up here in a little bit. Let me ask you this, and let's just continue on with you, Pastor Pitts. If we have some government leaders on, and many are watching on Facebook, some will see the replay later. If you had a request from industry, a request of government, a request from nonprofit organizations that would help your congregation, what would that be? Everyone's listening to you, and the question is, what's your ask?
I would say, put people above politics.
Yeah.
Right?
Yeah, that's true. Very good.
There's no way
Yeah.
in Haiti that we can sit down and get the same information from trusted sources and come with completely different messages without interweaving our own agenda. This pandemic and health issues has to be greater than a political, personal agenda.
Right.
Lift people above your politics, right? I think that's one. And two, you have to love people for who they are and not for what you want them to be. I don't know why, and I can't explain all the issues why there's health disparities, but there are. Let's accept the fact that they are, and let's do something about it versus arguing over why and who. They are there. Let's address the real issue. So my 2 points, and I'm sure my colleagues can do a much better job than me, is to love and lift people above politics.
And Shelley, I think that what goes with that I love about what Pastor Pitt says is that that's what we do in the church. And even as we come together as a collective, it's not about, am I building my own kingdom? Do I build friendship? Do I build second? Do I build new hope? We want to be able to build the body. We really are thinking more globally, bigger picture, build the body. And one of my favorite books, Black and Be Spiritual Leadership, says our job as leaders is to move people from where they are to where God wants them to be. And so we want to be able to move the people along. And so you can't do that if you already have an agenda and the agenda is not the people. The agenda has to be the people. The agenda has to be bettering their conditions. You talked about us doing this thing for our food bank, and I know Pastor Pitts has a food bank. I know that Pastor Goodjoin does stuff with food, is where food disparity became an issue for us, because even though our zip code in Yorba Linda does not say that there's a need necessarily for food disparity, we found that there are the people, especially the people that work in Yorba Linda, they don't live in Yorba Linda, they have needs. And if you came and saw, there are some people that you wouldn't expect to need food, but they need food because of how much it costs to live here. And my point is this: let's get past, as Pastor Pitt says, this politics and the angles, and remember that people have needs and we're here for the people. I'm not here for me or my own agenda. We come with some ideas, but ultimately when you start to see who the people are and what the people need, it will shift your agenda, and it'll get you to that spot where it's about me moving people where they are to where God wants them to be, and the place that's going to be most beneficial for them and helps them in totality. We don't want to do partial ministry. We want to do the best that we can to help everybody.
The question,
I think it's about, go ahead.
Just a simple question. I'm sorry, Dr. Goodjoin. The simple question is, am I more Christian than I am Black? Am I more Christian than I am Republican? Am I more Christian than I am Democrat? Am I more Christian than whatever other label I have? Dr. Goodjoin.
And does that push me in my work? Right? The idea that I'm a Christian, does that push my work and make my work more effective? Because it's more than just, as you said, this whole idea of us being binary, that we are so worried about being Christian. Being a Christian makes us love, not isolate and not kick people out, but it helps us to bring people in. Dr. Goodjoin, I'm sorry.
If your goal is to see our humanity,
right,
then you become present. You become present where humanity exists. You come to the margins. you make your face known, and you make your appeal an authentic appeal
That's
to
right.
work with people. And it goes beyond any political standing, any wondering how many people I can get to vote for me, but that I want to be present, because I know, and I have heard from at least 3 pastors on a Saturday morning, that there is a need for your presence.
That's right.
And your presence builds relationship. Your presence builds trust. And the first time you become present, you might not be trusted, but if you keep coming back, we will begin to see the authenticity of what you can bring and what we can bring. And there will be a mutuality, not only of regard, but of progress being made. I just think, I heard someone earlier say that, and it is true, we need to go to be on board meetings, and we need to be present at the table. But there is a table at church.
That's right.
Where the people are.
Yeah.
And to actually see these organizers
Right.
once a year, twice a year, 2 times a year, saying that, we together we can make a bigger difference. So I think it's like seeing our humanity and responding to that. Yeah.
And Shelley,
Thank you.
For political leaders, I want to be able to say this. We have no problem coming to the meetings. We have no problem doing the invocation. We have no problem doing any of those things, speaking, but we also need you to come to us. So as Pastor Pitts talked about, people, I think it's people, it's partnership. And then
it's
Pastor Goodjoy said, progress. We need, and I like to alliterate. So there's people, partnership, and progress. We need you to come to us, see what we're doing, see who we have, see what we're doing. Don't imagine who we are. Come and see who we are for real. Hear what our message is. See the work we're doing. These churches, if you want to hear what I want to say to political leaders, these churches are doing amazing work. If you come and see their food banks, see what they're doing with young people, see what they're doing with children and with families, doing amazing work. And we have access to people, your constituents. We need you to come see us as much as you want us to come see you. And we want to be able to be a part of what you're doing.
And there is also there's also the grant factor. See what we're doing and come in and say, you know what, there is
some money.
There is some money. There's a grant. There's a gift that can further the good work that you're doing in the community.
No, absolutely. Absolutely. I love what Pastor Curry said. People, partnership, and progress. And I think that, again, is one of our strategic goals here today, is to see how do we continue this collaboration, not just coming together once a year to have a program, but how are we partnering in February and partnering in April with the work that's already being done in the churches, and then government can come alongside of that and support with finances and other resources. So I'm excited that we're going to continue. I love when pastors get together and talk, because the conversation is so full of wisdom and just nuggets to live by. And so I want to thank the 3 of you. Thank you, Pastor Pitts. Thank you, Pastor Goodjoy. Thank you so much, Pastor Curry, for everything you have done to help pull this event together. And we're going to hear from you just a little bit later in our special presentation. And audience, I invite you, continue those comments. I see the chat is popping. Continue your questions. Again, if you have questions for these pastors, we certainly will get those questions to them and get you some answers. But thank you very much, pastors, for that amazing, wonderful dialogue. I really appreciate it. All right, we are moving to our 3rd panel. So we started with COVID. We just concluded clergy, and now is our 3rd and final component, and that is community. So I am very excited about this panel. We have 5 wonderful guests, and I'm going to start by introducing Mr. Junie Davis. Junie Davis is an Irvine business owner, community organizer, and a former U.S. Marine. Marine. He's a member of the Orange County Heritage Council, 100 Black Men of Orange County, and currently chairs the Martin Luther King Weekend celebration. Many of us know him because he's the owner of Creations Barbershop, which is known for its good haircuts, good conversation, diversity, and love of community. So I would love to welcome Mr. Junie Davis. Next, I am going to introduce Mr. Larry Wood. He is the Corporate Vice President and General Manager of Transcatheter Heart Valves at Edwards Life Sciences. He's had more than a 30-year career at Edwards and Baxter International, and has been tasked with key areas including R&D, operations, marketing, commercial, and clinical and regulatory affairs. Welcome, Mr. Larry Wood, and welcome again. Next, I would love to introduce to you a very special woman. She is the mayor right here in Orange County of Tustin, California, Mayor Leticia Clark. She was elected by her city council peers to serve as the mayor of Tustin for the 2021 calendar year. And she was also appointed by Governor Newsom to the Santa Ana Regional Water Quality Control District. Welcome, Mayor Leticia Clark. And not last but not least, but I also would like to bring your attention to Dr. Donnell Ivy. Dr. Ivy is the Director of Community Outreach and Education for the Association of Black Cardiologists. He personifies hope, persistence, and possibilities. And we've been so excited to work with Dr. Ivy, who has really helped us put this program together as well. And he's going to be sharing some exciting information. Welcome, Dr. Ivy. And finally, many of you know Miss Ernesto Wright. She is a native of Orange County and serves as the Executive Director of the Green Foundation. She has over 30 years of experience working in community health education and entrepreneurial experience. She is satisfied to be known as a servant leader working at the local level. Welcome, Ernesto Wright, and welcome to all of our panelists. Thank you for being here for our third and final panel. And I think all of us can jump in because we're all part of the community, but you are community leaders, and we're pleased to have you here today. So we've talked a lot, we've heard a lot, but I'm going to jump in with this question. Let's see, what could we do? What could we do to improve community-based approaches that would improve cardiovascular health and other health disparities in minority communities? What is it that we can do? What are some community-based approaches? And I'm gonna give that to you, Ernesto Wright, because you are, I know, on the ground doing the work. What are some of the things that we can do?
When you say we, what I echo what everyone else is saying about making sure that health education, early detection, health screenings, access to healthcare is a primary concern, as well as making sure that your voice is heard, as others have also shared about the city council meetings. Also making sure that your congregation is also informed in health education and actually take advantage of what organizations that are already doing. So you're linking with existing organizations that are existing doing the work. So some things don't need to be recreated. The Green Foundation offers health education on an ongoing basis. We've had 6 learning sessions from a pharmacist, Dr. Wissa, who is a pharmacist talking about COVID-19. That is a key message from a health professional. We've had health professionals from mental health doing sessions and focus groups so we could be able to have really good dialogue, like the dialogue that we're having here. Open that in smaller groups for the community to really hear their voice. People do not at the local level want 300 people to talk about their concerns, but are we really accessing, are we really being there for the community to be able to have the support that they're needing? So when we say we, I think we need to do a better job of making sure beyond our walls that people who are unchurched are getting the support, and the people who are church are also getting the support. And I'm talking from experience of 30 years. And when I say local, we're doing that hand-holding approach where we're pointing people who might have had a good paying job that need social services but want their dignity intact. So I think we need to have honest and open conversations. And as we're supporting one another in a serious way. So when information is being shared electronically, online, or in mailings, that you actually support those organizations that's already doing some of the work in the community. I see the we needing to do a better job of supporting communities that's already doing some of the work to really supporting those who are really are needing the help. And it's all private, meaning that we work with women with breast cancer, and I'll let Junie chime in as well, that's a conversation on a one-on-one where we do client navigation. And we've been doing that, providing that service as an organization for a number of years, but that's one-on-one. That's key messaging and making sure that they meaning getting the support that they're needing, because Orange County Healthcare Agency is a huge multiplex, multi-layer conglomerate, and it's very difficult to navigate. And so I was able to hear and share some of our voices in those areas to improve that access to the services that already exist in Orange County is a bear within itself.
Thank you. Yeah, you made such an excellent point that it is better to come alongside and support what's already working and what's already being done, rather than, collaboration is better than duplication or recreation. So that's an excellent point. Did anyone else want to jump in on that? What it is that we can do to improve community-based approaches? I'll move on to a second question, and I'm going to throw this to you, Larry. As leaders and industry partners in the local community, what are you seeing and what are you hearing that impacts healthcare in our communities? I assume as an industry leader, you've got your ear to the ground. What are you hearing and what are you seeing?
Well, I think we hear it from a lot of different places. We hear it from the hospitals that we work with, and we see all the challenges in the hospital, which has led to staffing issues and all sorts of challenges there. And so we hear it from that perspective. We hear the challenges with getting people to accept the vaccine, and the challenges in community of color are far worse and far more acute. And I would say, as we watch the vaccine rollout, it sort of happened in two phases. The first phase, I think communities of color and I think economically disadvantaged communities simply did not have access. So you watched, the more wealthy communities all get immediate access. And so there was this huge disparity there. Then once the access problem got solved, we ran right into the wall of the trust problem. And so many people spoke about it in the last panel. And I thought they couldn't have possibly been more on point, that we can solve access because we can throw money at a problem in many ways, but we can't solve trust with money. In fact, money sometimes pollutes the trust process. And so it's going to take leaders in the community who trust. And, I failed political correctness in college, so I hope I don't step under a nerve here, but how do rich white people invest in a fund? Because other rich white people tell them it's a good thing for them to do. And people listen to people like them, whatever socioeconomic status they are, whatever color they are, whatever they are. And so we need people who are in the community, who are relatable, who say, trust me, and people can believe that trust. And we're doing work now with former NFL players. A lot of people think former NFL players are all these super wealthy people. It's just simply not true at all. Most people that have NFL careers don't play for very long. They're not very careful with their money, and they struggle coming out of it. And their healthcare is as poor as anybody else's. The league didn't do a great job taking care of them. So we're trying to figure out, is there a way that we can access that group, because they're also respected in those communities? And so what are the things we can do? We also see it with our employees. We see it with our employees who come from all walks of life and all neighborhoods. We opened a vaccine clinic on our campus to try to address that. We sit right on the border of Irvine, Tustin, and Santa Ana, and we opened a vaccine clinic that was free for everybody. We set aside parts of our facility to be able to do that, to try to address that, just trying to be a leader in the community as a responsible company and say, hey, what can we do to try to help at least create the access, and then hopefully try to drive some trust? Because if friends of our employees start hearing about it and they know that there's an easy place for them to come, I mean, that's where I got my own nephews vaccinated, who they were resistant to getting vaccinated just because they're young and they're at that invincible part of their life. And I had to almost drag them there because I made it so easy for them. And I think that's a challenge we all have, but I think there's just always more that we could be doing. And we just have to look for those opportunities to partner, but nobody can do it alone. The community leaders can't do it alone, and the communities themselves can't do it alone. We're only going to do it with an effective partnership.
Yeah, and Shelley, may I add to what Larry just
Please.
spoke about? Larry, I just do want to make sure that it's corrected that we do need money as a trusted community, because with any program, you need a budget. So it is a part of it, because I am a trusted organization, but funding sure makes it a lot better to have an opportunity to really do the really serious work that some people cannot just depend upon volunteers. When you're looking at stats and reporting, that you need to hire skilled individuals to be able to maintain that performance. And so it does require a budget. And the reason why we're able to do as much as possible in Orange County is because we are finding those funds, and it's not always so easy, because that's also a part of a barrier, that's having access. Black organizations or Black-led organizations did not have access to the funding and the financial portion of it as well. And even going to the point of how we could get involved and getting connected with the commissions. Well, in a community-based environment, that we cannot sit on all the boards and go to all of these meetings and then still try to do the work. So there's an equity portion that is necessary, that grassroots organizations and community-based organizations are looked as a resource, as a business, because we work as no different than the County of Orange. Any organization, that's what community-based organizations do as well. Work from a budget to be able to do more work. And so then we're trusted partners on top of that, so that would be more impactful. But it's definitely want to make sure that it is a budget. Our faith partners, I'm thankful that Pastor Curry shared with me about this event and had this opportunity to share the voice, to echo that what each one of those pastors is saying. They're able to do more work, of course, within their congregation, if there's a budget attached. So I'm always frowned upon when from a business acumen, when I have 32 years and a business major and in business, that when you talk about don't put it in a budget, well, no one starts without a budget. No entity starts with no budget. So please don't ask any of us not to start with the budget. We need to have those conversations with the Orange County Healthcare Agency to see how capacity building money can be set up for health equity. Put money on the table. Yes, indeed, we could come to the table, because then we have power to be able to pay individuals the skills that they earn to be able to do more work in Orange County. You don't see us, but doesn't mean that we're not working.
Thank you. And we have, fortunately, Mayor Leticia Clark, who perhaps could speak to that. And Mayor Clark, tell us what you're hearing and what you're seeing from the residents of Tustin and from Orange County.
Well, I'll start by expounding on, I think, what Ernesto and Larry both said. Ernesto, you're right in that our values are reflected through our budgets. Our values are reflected through the way that we expend and allocate funding, especially through government. When you look at our line items, depending on where we decide to put money, that can tell you a lot about, the status of a city or the status of the government. What are we deciding to, put more funds in? Are we saving more for a rainy day, or are we putting more toward, community programs that deal with people every day? So I think you're exactly right about that. I also really liked what Larry said in that he gave the analogy about how people decide to invest in, maybe funds or stocks that they don't know a lot about. They ask other people so that they can, have that referral. And what I think we forget about sometimes in the minority communities is that we do have to rely a lot on each other. And frankly, government should be that for many people because we can't read every label. We can't attend every meeting. We can't, just kind of regulate everything that we consume in our lives or that impacts us in our lives. So we have to trust our elected leaders. We have to trust government. We have to trust that certain organizations and companies are doing their job in making sure that things are safe and that benefit us in the way that they're purposed to do so. So when I meet a lot of people that still have concerns about the vaccine, which there are a lot out there still, I have to encourage them to look at credible sources, look at sources that they trust, because yes, you may not know every single thing about the vaccine, but you also don't know every single thing that's in a McDonald's fry, but you still may order them because, you've been there plenty of times or, your family's always gone there. So it's just really important that we have those trusted people in the community. So still hearing about a lot of vaccine hesitancy in the community. Also hearing from groups that and parts of the community that still aren't getting their basic needs met. That's a concern. If they're still worried about food, accessing a job, worried about housing, worried about education, it's hard for them to think about preventative health. It's hard for them to think about being more engaged in their communities. So as an elected leader, that tells me, okay, we need to pour more funds, budget correctly for helping the community meet these basic needs so that they can start to care about and be more engaged in some of these other issues that have these long-term impacts in our community. What we're talking about today is something where we're asking people to be more cognizant of their long-term health, more involved in their preventative measures that they can take to ensure the health of themselves and their families and their communities. That's hard to ask people when they don't know where their next meal is coming from, or they have housing instability or job instability. So as an elected leader, I try to make sure that we're partnering with organizations, that we're utilizing funding correctly to help meet those basic needs so that the people in our community can live a better quality of life, be more engaged in the things that impact them on a long-term basis, and then subsequently become more engaged in the community so that they can attend council meetings, they can serve on commissions, they can be those voices and those trusted voices that we need in the future to impact people around them in their neighborhoods and their communities when it counts and when it matters.
I think if there's a through line and a theme of today is that we understand more than ever before that health and heart health is not just about health itself, but there's so many other factors that really, really make the difference for folks. And it's exactly as you said. I'm going to have you jump in here, Junie. Tell us what you're hearing from the folks at Creations and in the community. Junie Davis? Okay, he might be muted. Let me bring you in, Dr. Ivy, because you're doing some great work and you all have some wonderful community programs that the Association of Black Cardiologists have, including Spirit of the Heart being one of those programs. Talk to us about some of the solutions you all are looking at the ABC.
Yes, thank you so much for allowing me this chance to talk about that. ABC wants to be a partner with local organizations and community members to really stress the importance of cardiovascular health. We know that COVID has been dominating the news, but we want to let individuals realize that cardiovascular disease continues to be a major risk factor and a major cause of death. What we do at the Association of Black Cardiologists is we like to work with community organizations. So with Miss Wright's organization, for example, and with Mr. Davis' organization, and help to implement programs that increase awareness about cardiovascular disease, but also how to take steps to improve cardiovascular health. So two of the programs that we had, as you just mentioned, this Spirit of the Heart program is one of our programs to really bring together community leaders to talk about how can we begin to change the narrative and address those cardiovascular risk factors. We like to engage the community because, as Tip O'Neill said, all politics is local. And so working with those local organizations, how can we better get the message to community members? Another strategy that we like to use is our community health advocate training program. This is a program in which we train community members to use the With Every Heartbeat is Life manual developed by the National Heart, Lung, and Blood Institute to train others and educate others about the cardiovascular risk factors. We use their manual. It has 10 sessions that are on the risk factors that include hypertension, includes diabetes, overweight and obesity, and the importance of physical activity, as well as others to train individuals to deliver that message. And we like to use individuals from the community because they're trusted messengers. Individuals that live in the community know the situation a lot better than we could. So by educating them on how to use the community health advocate training manual, we hope to then expand the number of individuals that are in the community that can advocate for better health. Another program that we have is our Barbershop Initiative. And I do hope that we're able to hear from Mr. Davis. But we know that barbershops and barbers are trusted members of the community. So teaching them about how to deliver messages around hypertension, teaching them how to take blood pressures, how to talk about the importance of being vaccinated, not just against coronavirus, but also flu vaccines, is something that we really like to engage the community with. So those are just a few. I hope that we're able to hear more from the panelists, but ABC wants to be a partner with you in really improving cardiovascular health.
Absolutely. And I know we've been talking about, along with Pastor Curry and some of the other organizations, bringing the chat program right here in Orange County and training community members to be advocates. So I'm looking forward to that. And again, those of you that are on and listening, keep your questions and comments coming. And we are going to talk in just a moment about how you can get involved in the chat program and some of these initiatives. We, again, want to develop these partnerships and collaborations so that we could keep it going, keep the funding funnels coming, and not recreating the wheel, but just partnering together to get this work done. Junie, were you able to unmute and jump in here?
I hope so. Can you hear me?
Oh, yes. Thank you so much. Share with us what you have and what you're hearing at Creations and even beyond.
I'm hearing a lot of what I've been hearing on this call. Hesitancy, lack of trust, wait and see approach. We're hearing all that. But I just want to address one thing. I work with several nonprofits. Money's always an issue. That's our biggest struggle, is how do we pay for what we're trying to do? And the second biggest struggle is we need more volunteers. I see the same people, a lot of us are everywhere doing a little bit of everything. Yeah. So we definitely need more volunteers. I just wanted to get that out. But the barbershop, my barbershop specifically, is open to the community, whether it's testing, whether it's pamphlets, whether you could send us video we can play in the barbershop to educate. Education is a big issue. And I'm thankful that I have clients that were educated on heart disease and COVID, where we had like little mini town halls, because we've heard all the crazy stuff. So I just tell them, okay, throw a question at Doc. And we have a town hall, and I've had some pretty good talks in the barbershop that pretty much killed a lot of the mess that's out there. So we need more education out there, and funding for sure.
And Dr. Ivy.
Oh, please.
I'm sorry,
go
Shelley,
ahead.
could I go ahead and add to what
Please.
Dr. Ivy had shared about 100%, and I'm really happy to say from a professional to personal that I know Dr. Richard Allen Williams. He's been a supporter of ours for a number of years, and so I will be contacting him next week to let him know about the Spirit of the Heart of Orange County, because he has been a champion and he's been one of my encouragers from in LA County as well as Orange County, continue to do the work. So we're already in. So I just want to let you know that he's definitely, truly someone that I admire, and knowing about community health and how the heart disease is so much impacting the African-American community. So I just want to make sure that I share it with everyone how much I am pleased that Dr. Williams have been supportive of us for quite some time. And that I wanted to share too, that the Green Foundation is working with the Centers of Disease, as well as Health and Human Services from a statewide, as well as a national-wide level, connecting with individuals at vaccination sites to find out what is their voice. We're doing surveys. What are you saying? We want to be their voice so that they're able to have messaging in a way that they need to hear it. And that was the reason why we do the listening sessions, as I mentioned earlier, because people need to know for themselves. And I believe that when we educate people, they make their own choices, but I want to make sure that we're doing all that we can to give them the options that they need to make their choices. Even some of our community health workers have gone out to homeless embankment. We don't service necessarily the homeless population, but they are still knowledgeable. They are still wanting to be treated as human beings. They still want to make sure that people see them and not look at them differently, even if their views and opinions are different. I believe in relationship building, one, because I'm a woman of faith, that when you build a relationship with individuals and you care about your community, people will come and respond to just that. And yes, there is a plethora of issues, but one reason that I love these types of panel meetings, that we could come together. We don't have to agree with one another, but when we speak truth and want to do meaningful work and really be able to help people's lives, that's what it's all about. And that is what we're going to be taking away from here. So I appreciate Association of Black Cardiologists, the Edwards Life, you, Shelley, of sharing, and also the African American Alliance Fund, and to continue, not just talk about it, because my job is what is next? What is the action item? How do we get this message out to our community? Because one life, and that sounds like a cliche, but if I asked you the value of your family member, if I ask you the value of your child, what is the value? So if we are able to support and connect with one person's life, has changed. We made a difference. You know, we made a difference. So I really appreciate this opportunity, Shelley.
Absolutely, absolutely. And on that, because I do want to be sensitive to the time, we're getting very close to noon. And again, I know we could sit in the living room with Mayor Clark and Junie Davis and Ernesto Wright and Dr. Ivy and Larry Wood and carry this conversation on. But I do want to just ask you, Larry, just for a closing comment, because what we're getting ready to do is we're going to talk about next steps and how do we move forward. And at this point, I'm going to ask the audience to get ready, because we've got some questions that we're going to have you answer in the chat. So everybody pay attention to that. But Larry, give us a closing comment just in terms of community organizations and what we can do moving forward.
Yeah, I think, you know, with so much has been poured into vaccine access and all these other sorts of things. What I'd love to see is, as this pandemic goes away, and certainly at some point it will, taking all of that funding and taking all of that energy and converting it into basic screening for cardiovascular issues. We've created this infrastructure. It'd be a shame if we just rolled it all up at the end of this pandemic and put it away. We can leverage that infrastructure. We can leverage those investments, and we can do just basic screening, blood pressure, cholesterol testing, just the most basic of things that have such a huge impact on people's lives. And I think if we were going to do something actionable, it'd be able to figure out to say, how do we move from pandemic to just basic cardiovascular health?
I love it. I love it. Screenings. Mayor Clark, give us a closing comment. What are you feeling and sensing in terms of next steps?
Well, I hear from everyone. Communication is important. Being an advocate is important, and we know these tools work. But I think what we have to settle in is that it's hard work. And if it was easy, we'd all be doing it. We'd all be doing it on a regular basis. But it's difficult. And Junie kind of mentioned something that we're all involved in all these things, and so it's hard for us to keep that momentum going. I think all of us understand it's definitely a marathon, not a sprint, but a lot of us get burnt out, and so there's much work to go around. So we'll say that, but also we gotta, kind of just keep the momentum going. One thing I started in Tustin was a connection group with faith-based leaders and nonprofit leaders, and we meet every other month. Sometimes we don't have anything to talk about, but just that consistency of meeting on a regular basis allows us to hear from each other. And then just, every blue moon, there's a connection made where it's the perfect timing, the funding's right, the partners are right, and everyone at least has that opportunity to discuss and dialogue. So even though it's not easy to have those meetings over and over again, sometimes when we don't even have an agenda, it's important that we keep that connection going, because there will be a time where we all, need each other and have to have that communication line open. So I'll just leave you all with, it is hard work. There's much work to go around, but once you get involved, just try to keep going. Don't get burnt out, because there's much work to be done.
Thank you. Thank you. And I'm going to ask you all just stand by for a moment, because we have a question that's going to be in the chat. Do we have that question ready? Question number 1 is, did you know, audience members, that barbershops act as places to screen for cardiovascular health? That's our first question. Did you know that? And you can answer yes, no, or I don't know. Do we have the question up? All right, go ahead and answer that. And while we're answering that, Junie, I'll pose this question to you, and you've answered some of this, and that is, how can barbershops help over the next several months? And I know you talked about making your shop available for giving out information, because you and your shop are a trusted resource. Anything you want to add about what barbershops can do as we continue to fight cardiovascular disease and others?
Absolutely. A big part is culture, right? Your barbershop culture matters. So just by chance, I didn't design this, but I have a bunch of healthy barbers that work there. They bike ride on the weekends. We got some that's marathon runners. We got some bodybuilders. They coming in eating broccoli and granola bars, and it's infectious. You get other clients, they're coming in, they're looking at you like, man, and then next thing you know, they're telling you how they're eating granola bars and broccoli now and working out. So one big thing is just creating a healthy culture with the information to support while you're doing what you're doing, So, getting the information and having a healthy culture, I would say is big.
That's excellent. And we are certainly going to be engaging with you after to keep this thing going. But I'll move on. So we have, we also had some questions. Which health-related activities should barbershops offer or organize? And then, how often should the barbershop organize health-related events? So we want you all to answer all of those. And as you heard, barbershops like Creations are doing a lot of this work, and we want to continue that work. This next set of questions is really for Orange County government. And what I want to do is ask the questions: should the local government fund health activities in barbershops and churches? What do you all think about that? Should the government fund it? The next question: what groups should government convene to administer health activities? right? And then lastly, how should the government engage the community to develop targeted education and awareness campaigns? And I think we've established this has to be all of us, right? So we need faith, we need government, we need industry, we need community. It takes absolutely all of us. And Mayor Clark and even Mayor Pro Tem Hurt, Supervisor Foley have spoken to that. I'm going to hasten for the sake of time and just in terms of the faith community, pose these questions and give us something to think about in terms of moving forward. We heard about health ministries and churches and the work that's happening. And so I want to just ask the question, did you know that churches and health ministries can serve as places to screen for cardiovascular health? We talk about whole life ministry, right? So ministry to the whole person, which includes body and spirit. A second question, which related activities should church ministries offer? Another question for us to think about. And Pastor Curry, Pastor Pitts, Pastor Goodjoin spoke to that. And then I'm going to end it with this question, and that is, how often should churches and health ministries organize health-related events? And think about that question as we move forward. I do want you to know, for example, the CHAT program, the Community Health Advocacy Program that Dr. Ivy talked about, we are going to be offering that. And so we will be engaging you, community members, to sign up and be a part of that. We will be engaging you about activities at the Barbershop and other local organization, places, and spaces. So think about these things as we think about moving forward. So much has been said, so much wisdom has been shared and poured out for us today. But I hope that you have taken it all in. You're going to be hearing from us. You'll be hearing from me, because we want to not just keep the conversation going, but we want to get to doing some of this work. So I want to thank you for having me as your master of ceremonies today. Keep engaging, keep the questions coming, and thank you again for attending. Now, we have a very, very, very special closing and presentation sponsored by the African American Alliance Fund. So at this time, I'm going to turn it back over to our Orange County sponsor, Dr. Jacqueline Ubani, who's going to do our closing and our very special awards presentation. Dr. Ubani?
And thank you very much for that, Shelley. So this year, we've launched the Spirit of the Heart Community Health Advocate of the Year Award. The award is sponsored by the African American Alliance Fund, a very important partner in addressing health in our community. We would like to send a special thank you to the African American Fund for helping us recognize the important contribution of advocates in improving the health of the Orange County community. So this year, for 2021, we're giving the award to a collective of 5 predominantly African American churches in Orange County who came together early in the year to host the first vaccine clinic. So give a round of applause for our 5 churches, and they include the Friendship Baptist Church, represented by Pastor Kenneth Curry, Second Baptist Church, Pastor Ivan Pitts, the New Hope Presbyterian Church, Pastor Chinetta Goodjoin, the Church, Christ Our Redeemer AME Church, Pastor Ralph Williamson, and lastly, Johnson's Chapel AME Church, Pastor Delman Howard. Thank you so much for all of your efforts in helping our health in the African American community. So in closing, I'll have to say that this has been an excellent discussion. The panels and all of the sessions have been great. I have learned so much, and I hope that all of you have learned a lot as well. So to summarize, heart disease remains the #1 killer of people in the United States. The highest death rates are seen, again, in the African American community. The take-home message from all of this is that heart disease is preventable. Studies have shown that you can decrease your risk for heart disease by up to 80% by implementing some simple lifestyle changes. So you have the power to improve your cardiovascular health. And in terms of COVID is here to stay. It is endemic. You should get vaccinated to decrease your risk of getting very sick from this virus or even dying from this virus. The vaccines are safe and effective. So of course, we cannot close an ABC event without going over the 7 steps of a healthy heart that was put forth by the ABC. And they include step 1, be spiritually active. Step 2, take care of your blood pressure. Step 3, control your cholesterol. Step 4, track your blood sugar. Step 5, eat smart and enjoy regular exercise. Step 6, don't smoke. And step 7, access better health care and take medications as prescribed. So thank you everyone that has joined us in this important discussion. I'd like to thank all of our presenters, including Katrina Foley and Katie Calvota, for sharing with us the burden of COVID-19 and heart disease in our beloved Orange County community. I also would like to thank all the panel members, including the COVID-19 panelists, our faith-based panelists, and community-based organization panel. Your organizations are definitely doing wonderful work to help make Orange County strong. Also, a special thanks to our masters or mistress of ceremony, Dr. Shelley Henderson. You've done such an excellent job in leading this forum forward. And lastly, special thanks to all of our co-sponsors, especially Edwards Life Sciences Foundation and the Association of Black Cardiologists. Thank you all so much for taking time out this morning to join us for this important session. And we hope to see you next year. And we hope our session next year will be live. Thank you.